initiatives and work that you would like to update on and you feel is would be something that others have interest in, there's an opportunity at that point to share your update. So please keep that in mind. Next slide, please. So just starting off, I wanted to give you an update on the GNC leadership team. Since we've last met, there has been some changes in the composition of this team as some staff have moved on to other roles. So some faces you will recognize and some are new. So to the welcoming newly to the leadership team, we have Vic in the GNC program co-lead role alongside UNICEF. We have Anu as well, representing UNICEF programs group. We have IMC here representing the technical lead agencies of the GNC. And I think everyone else, Andrew, Rasha, myself, Nat, Stefano, we were all here before. So I won't labor on this point, but I wanted to just take a minute to update you on the composition of this team now. So I'm going to pass the floor over now to Stefano, and he is going to take us through some updates on the Humanitarian Reset. And if you could just make sure your mics are on mute, that would be great. So over to you, Stefano. Thank you.
Yes, please, colleagues. Thank you very much. And thank you, Colleen. And welcome to this call. I have a few slides. Already we have several 65 and counting colleagues joining in, and they may continue to join for the next few minutes, I guess. But I will start anyway, and I'm going to try to give you a brief update on the Humanitarian Reset. Now, okay, so the Humanitarian Reset was launched in March 2025 by the Emergency Relief Coordinator as a reform initiative designed to make the international humanitarian system faster, lighter, more accountable, and more impactful in a context already of shrinking funding and growing complex crisis. Now, we are currently in the phase 2 of the reset, and this phase focuses on what are known as the 4 Ds: define, devolve, deliver, defend. And these are aimed to shift from a control-based system to one based on collaboration and in particular on local leadership. So the 4 Ds, define, it's a focus on greatest needs, strictly on the primary focus is on the greatest needs or hyper prioritization of global appeals to save lives with limited funds. Now, obviously, this doesn't mean that other reports may not cover the whole needs, but in the humanitarian response is going to try to prioritize those hyper prioritized gaps. The second D is devolve, and it's about people-centered responses, calling for a shift of power and resources and leadership closer to local crisis. And it strengthened local and national partners who are the first responders, shifting from international to local leadership. And this is something that the GNC has prioritized for over many years now. Now, the third is deliver in a timely and streamlined fashion. So the objective is to make operations lighter, inclusive, and faster, and streamlining in-country coordination, including reducing the number of global clusters from 15 to 8, which has already taken place earlier on this year. Also, this calls for the greater adoption of area-based coordination to focus on the community level and increase the use of multi-purpose cash assistance. The last D is defend, and it's about defending protected principled action, international humanitarian law, and humanitarian workers. This can be achieved by using creative, agile humanitarian diplomacy to protect access, visas, and operational space for all actors, local and international. Now, there are some also enablers of the reset, which include a greater commitment to more equitable partnership with local actors based on trust and shared risk management. Shared services, in particular data, logistics, needs assessment, as a default approach to reduce duplications, and in many instances also increase the economies of scale. Broader financing, reducing primarily donor conditionality burdens, and also an overall approach to bringing sustainable practices for climate-related challenges. Next slide. So the reset emphasizes strengthened community engagement, institutionalized consultation, and joint interagency feedback systems. And for 2026, the humanitarian program cycle rests on 4 building blocks. Needs analysis, which looks at the scope, the severity, and definition of people in needs. Response planning, which focuses on the standardized strategic objectives, targeting prioritization and community-driven activities. Financial requirements, it's about leveraging existing costing data and simplification of the calculations for those requirements. And monitoring, checking that responses align with the severity of needs and people in the prioritized domains. Across all these, obviously, protection remains central and integrated across all stages. The HPC for 2026 will remain a tool to help us mobilize resources. Without urgent donor engagement, we risk falling in our objectives to meet even the most critical life-saving needs. The guidance is available on the OCHA website. Next slide. Localization. Localization for the GNC is not simply the transfer of resources or roles to local actors. It means strengthening malnutrition prevention and treatment, resulting in better child survival and thriving, because decisions become more relevant, timely, and protective when they are informed by those closest to children and other vulnerable groups at the local level. So key components of the localization strategy during the reset and also for the GNC includes the strengthening of local and national NGOs representation. We have an objective of 25% at least local and national actors representation in HCTs and cluster SAGs, and also a representation of at least 50% of local and national actors, co-leadership of clusters, and these local and national actors also require resourcing, capacity assessment, and action plans to support their empowerment and leadership. Now, the nutrition cluster in particular has already exceeded these targets already for some time, as we are almost totally co-led by national authorities, at least in countries where national authorities are able and willing to uphold humanitarian principles. And where in those few countries where they are not, then we will ensure that co-leadership or co-coordination is conducted with a national NGO. So also there is an objective of increasing direct funding to local and national actors. So allocating at least 25% of humanitarian funding and 50% of country-based pool funding. And also this is a target that, at least for the UNICEF-led clusters, including nutrition, this target has already been achieved. Also, there is a component about raising enabling costs. So UNICEF as cluster lead agency currently allocates 7% for program support costs, and we are going to explore increasing this to 10% to strengthen LNA's leadership and delivery. Also, there are important efforts to harmonize ask-wide due diligence by the middle of this year, and which builds on the UN partner portal and wider UN simplification efforts. The last point is really about monitoring the progress in our localization agenda, and we're already supporting a light localization snapshot, and we are recommending integrating perception, service, and qualitative indicators on partnership quality, LNA's leadership, equitable risk sharing, and perspective of national and local authorities to better guide our progress and future priorities. Next slide. Area-based coordination, quite a hot topic at the moment. It's so area-based coordination in the reset has been explored as a complementary model to clusters. It is not a replacement, but rather a mechanism to support coordination in specific geographic areas at operational level. Geographical coordination, complementing sectoral coordination, and these principle borrows from other models like the refugee coordination models that may also need further integration and there are ongoing discussions about this. Last slide, next. Okay, so in terms of next steps, at the country level, we obviously encourage nutrition clusters and our partners to support the adoption of coordination arrangements so they are generally fit for the context. So there is no single model that can be applied everywhere, and the expectation is that coordination really reflects community needs, nutrition priorities, and local capacities. It's also really important to bring local actors, especially women-led and community-based organizations, into nutrition coordination structures, whether ensuring that they have representation at the HCT, in cluster leadership or advisory level. Local voices must really be supported to help shape nutrition decision-making and response priorities. And obviously, when we talk about local and national actors, we include national authorities who should be the primary duty bearers in humanitarian preparedness and response. It's also important to support an institutionalized consultation with crisis-affected communities, including caregivers and frontline workers. And we hope that these processes really are done in such ways as they really help define nutrition priorities. All the processes described by the Humanitarian Reset really require accountability, first and foremost, to people, not just to donors. It's also important to engage proactively with donors on nutrition funding, especially pooled funds. We need to all work together to advocate for increased contribution and far more direct resources to be channeled to national and local actors who are leading nutrition responses. It's important to remember that simplification is not only about reducing the number of meetings for nutrition, it's about ensuring coordination is more meaningful, more accountable, and more locally led. The Reset roadmap is really designed to support us in moving step by step in that direction. Lastly, I really want to reassure everyone that we are still here for you, even if there have been some changes in our structure. And please do not hesitate to reach out to us, the GNC team, at any time. Thank you.
Thank you very much, Stefano. Just to remind everyone, if you have thoughts or questions that come to mind during these updates, please do put them in the chat or make note of them so that we can address them in the later reflection and Q&A session. So Inez, are you online now and can give us some updates regarding the transition? Over to you, Inez.
Thank you, colleagues. Sorry for being late. Can you hear me?
Yes, loud and clear.
Okay. Next slide. So I just wanted to give you a little bit of not a broader update on transition, because I think you are all aware of the guidance that were released recently on the transition and the activation of clusters. But just to give you a little bit of perspective on how countries are transitioning and what are the main highlights and the elements that we want to share with others. So currently we are seeing that there's no such a sector individually transitions. There are countries where there is a more system-wide transition with all the humanitarian coordination, but humanitarian structures also. And we know that there are 8 countries that are doing that. And 3 of them, they do have clusters activated, but also we know that there are countries where this discussion on how to transition is being under the table in many, many discussions. So just we want to emphasize some of the messages that transition is not an event itself, it's a managed process. Because we have seen that it comes at the last minute to say we need to transition, like now this is what you just exit. But we want to reiterate that this is a process. It is not a cluster exit per se, even though we recognize it goes to a deactivation, but it's a system shift. Why? Because we think that we need to reconfigure the coordination system from a cluster to a sector or to area-based or something else. We are transitioning countries really early now because of the funding constraints, not because of the needs have been reduced or the capacity from the government side is 100%. So we are doing this kind of forced or accelerated transitions in many countries. So this needs to be discussed as a full system reconfiguration, not just to request individual clusters to transition, do planning, transition, and do it in isolation. So we insist that we need also more collective decisions. It's not cluster by cluster. And for nutrition, maybe it would be interesting also to link with other clusters to see if there are elements that can be mutually reinforced. And that's why we suggest to have a more shared transition logic with the same timelines and non-negotiables. So it's not individual sectors on their own, even though we acknowledge there might be different modalities or different specificities for each of the clusters. One of the messages from the Humanitarian Reset, and I think Stefano was presenting that, is transition since day one. This is the title, right? It's not easy, but we might not think about transition when we are ready to deactivate or we are ready to leave, we're ready to shift to something else. It's since day one. So whatever we are doing as a cluster, we need to think about, we will need to transition to someone else. What is the capacity building we're doing, not just for now, but also for the future, and how we have that planned on purpose and early on. Another element is when we are just doing transition, there are some elements that are more cross-cutting and some of the coordination functions that are not specifically for each sector. So for us, that's important that we also protect those minimum cross-cutting and coordination functions in all clusters, and we maintain those levels, whatever system is going to be after a cluster. So the analysis and prioritization will remain, even if there are no clusters in many contexts. And I will talk about the context of Cameroon. I don't know if there are colleagues from Cameroon in the call. Information management and data continuity. The fact that coordination forums or platforms will continue working with whatever name we want to give. Partner engagement is something that whoever is going to lead a sector or area base or whatever, they will need to continue. And also to define those escalation and accountability pathways. So transition is not that we just withdraw anything. It's more than an investment in a period of time that things will be done differently, but probably will come back. So it's kind of good response. It's kind of how we do localization, how we get prepared for the next crisis that will raise. And we have also, and specifically this is for UNICEF as cluster lead agency on nutrition, but other clusters, with our dual mandate, it creates time to times a little bit of ambiguity. If there's not clear definition, this is a cluster, and then whatever we transition to something else, what does it mean for us? Slide. Now from the perspective of the practical insights coming from Cameroon as other countries, we are observing that in many contexts, as the case in Cameroon, whatever is being proposed as part of that transition, this is not specifically for nutrition, but it goes for almost all the clusters. They are proposing, in a transition country, instead of simplifying the process and the structures, they are proposing coordination layers in areas because of different considerations. But we see this as a high risk when you have clusters, you have sectors, you have inter-cluster coordination groups, you have new humanitarian coordination platforms in a regional level, you have area-based structures in the operational level. So everything coexists, and there is no clear articulation how this will work together. And I think it will create a little bit of duplication and maybe blurred accountability that might also have an effect and impact in terms of the response. We also saw in Cameroon that the area-based coordination proposed at the divisional level really adds a value because it's an operational multi-sectoral coordination mechanism, but it's not the suggestion to transition from cluster to area-based. We don't see it as a clear pathway. We need also sectoral coordination to be supported and to maintain that sectoral authority that is really needed. So we need that to be safeguarded. There has been discussions also of the perception in some contexts like Cameroon of cluster being perceived as service provided only, but without any authoritative sectoral accountability. And that's a risk, again, that goes against all the efforts that the clusters are doing in a place for a long time. We say that the frameworks itself are not enough. We know that the plans, the strategies, whatever we're doing are also good, but we don't talk about expectations, decision-making, pathways, how the resource will be allocated. Those kind of things needs to be part of any transition discussion. It's not specifically mentioned in all the plans or the guidelines or the annexes of the guidelines of transitioning, but that needs to be required. The case of Cameroon is clear. They want to deactivate in June the clusters, but the HNRPs will continue till December. It's not clear what are the expectations for July till December in terms of sectoral outcomes or sectoral information and results. If you don't have the clusters and you just have area-based coordination and you don't have sectoral coordination, because the HNRP, as you know, is organized by sectors. We also need to think about the accountabilities of a cluster lead agency that goes beyond the cluster deactivation itself. So as UNICEF, we know that we have this dual mandate. What might be our accountability when we shift towards something else that called sectoral leadership with the government or other elements? What is the the management of that sectoral leadership, how we will support after that deactivation. I think specifically for nutrition in Cameroon, there was also a discussion around the need to have an alignment between the response planning and the transition planning. The way, and it has nothing to do with the nutrition colleagues there, nutrition cluster colleagues there, but the way it has been organized as a transition for the system is you provide your transition plan, but there are not discussions in the HCT around response planning and how this links with transition. So you have an HNRP that has been planned for a while, now you're doing transition and you don't match the two of them. Well, I think it's important to be done sooner. Slide. Next. So yes, based also on the Cameroon experience, instead of doing the diagnosis and also the analysis of how to do the transition cluster by cluster, it's important to do it jointly with others. So this is an encouragement to do it together with other UNICEF clusters, but also non-UNICEF clusters. It makes sense in a country to do it with health or to do it with food security. Why not? Discuss a little bit more about the development of a post-cluster architecture and what does it mean, and what are the interfaces. It's not just the structure themselves, but how they will be connected. And then think about a moment in the transition phase that you have the dual operation. So clusters alone, sector coordination alone, area-based alone, anything, because that needs to be tested. There's still not a lot of transition experience in many contexts. So we need that as part of the learning and improving practices that we have. And then formal deactivations needs to occur with safeguards that are in place, because some of the core functions continue under new frameworks. So it's not because we have deactivated cluster that we leave everything. And we need those functions to continue, and we need to document those processes. And next slide, I think is the last. Just as a key messages again, so we realize information management is not a short-term or a time-bound approach. It's something that needs to continue during transition and maybe after. There's a lot of risk if we don't maintain that function in a place. It does not mean that it needs to be dedicated to a sector. It does not mean that it needs to be as it used to be when the cluster was activated, but that's required. The capacity also, it has to do more with the skills, not with the structures themselves, but also, and I know nutrition cluster have been working a lot on the national local capacities to continue being retained and strengthened. Even if there is no cluster activated because there has been a transition process and then till the activation, national local capacities needs to be aware what does it mean to activate a cluster, what does it mean to do coordination, what does it mean many things, right? So that will continue. As I mentioned before, there's not a lot of documentation on the countries that have transition, so we're trying to encourage to have this peer learning of countries that are living the same situation and have more peer-to-peer exchange at the operational level without any guidelines that we need from the global level. And again, one of the most relevant messages is the boundaries in terms of accountability, but also related with decision making of any of the structures that will be proposed after any of the transitions. This is the more relevant point that needs to be part of any transition discussion. I think that's all from my side, and nothing new, but just to highlight some key messages. Thanks a lot. Over to you, Colin.
Thanks, Inez. Very helpful information for us all. It's obviously transition's a very complex process. So I really appreciate you joining us today to walk us through not only like the theory of it, but also some practical observations that you have made. Next, we're going to move to an update on GNC annual work plan. So I invite Andrew to walk us through this part. Are you there, Andrew? All right. Okay, I don't think Andrew is online. So Victoria, are you able to come on and walk us through the work plan? Thank you.
Sure, Colleen. Good afternoon, good morning, colleagues from wherever you are. On behalf of the leadership team, I'll just walk you through the GNC annual work plan, which really operationalizes the GNC strategy that we all collectively launched on the 19th of February this year. And the work plan really just, brings to life the vision that is articulated in the strategy and communicates our shared aspiration as a collective on areas around coordination and partnerships, building our skills and capacity, and importantly, advancing key elements around localization, equity, climate responsiveness, accountability, and inclusion, which are all factors that we're increasingly facing within the humanitarian space. Next, please. So looking ahead, the work plan is organized around 7 key pillars, and I do hope that as we go through these pillars, we will all be able to see ourselves in it, because it enables us to work together across our different organizations to be able to deliver in a more cohesive manner, particularly in a background where we are now seeing greater shifts in how global diplomacy is organized, as well as, increasing reduction in funding for humanitarian action. And so you will see that the 7 domains actually also provide practical ideas of where partners can come in and the different elements that we can all engage in. Next, please. And so to briefly take you through the 7 pillars, we have our first pillar around capacity, which really is, front and center of the GNC strategy. We want to achieve a situation where practitioners at country level and indeed at global level have skills, guidance, and support to deliver effective responses as we see the humanitarian landscape is getting more complex. And some of the opportunities here include working together to develop learning pathways. In the advent of AI, there are new opportunities to improve our ways of learning, and importantly, how this is delivered to our frontliners. Contributing our collective expertise to technical support missions, supporting country-level capacity strengthening, although we do acknowledge that countries have also made great strides in strengthening their own institutions, in building systems. And so there's still room to do this, particularly in fragile countries. We are also having a pillar that speaks to the part of evidence that we have worked on over the years, and we need to see how to take this forward in order to strengthen our response. And the opportunities here that present themselves to us as a collective include in how we come together to co-develop guidance and briefs, how we contribute to operational learning and case studies. We are all invested in one way or the other in different thematic areas, and we need to talk about this. We need to share evidence to take interventions to scale. Participating in webinars, knowledge exchanges, and importantly, raising voices of communities who are impacted by crisis, youth, children, really having an equitable approach to ensure that we leave nobody behind. Similarly, we have a pillar that looks at rapid technical support to country responses. And another key opportunity that presents itself here is that we should be able to provide short-term deployments through the advisory roles, support our regional and national specialists also to engage in global response mechanisms as we develop global rosters and surge lists. as well as contribute to technical quality assurance and peer review mechanisms. Another pillar that the work plan advances is that we would like to strengthen our ability to come together to jointly advocate and communicate on behalf of the nutrition sector as a whole. We want to shape our advocacy messages. We need to be stronger together now more than ever with everything that's happening geopolitically. We'd like to contribute to sessions and discussions at global level in key humanitarian events. We have the UNGA, we have the Rome Nutrition Week, the Health Humanitarian Summit that's happening now in Nairobi. There are various opportunities for us to engage in a very structured way as a collective. We do need to continue amplifying nutrition priorities. We have countries where for the first time we have 2 famines, in Palestine, parts of Palestine, as well as in Sudan. And so this is a critical time to continue raising the profile of nutrition, given the level and scope of suffering that we are seeing in different parts of the world. Next, please. Linked to advocacy, of course, comes in the whole issue of mobilizing resources. More than ever, we need to come together to approach donors together, one voice, one message, to really finance the needs that are there. And today, part of the presentation that our colleagues from UNICEF and WFP will share with us will be highlighting critical needs in different dimensions of the program, especially around supplies. So we do need to come together, resource mobilize together, share our advocacy priorities in a collective way, champion investment in nutrition coordination. As we are doing the transition now, we do need to ensure that governments take this on and sustain it to be able to keep the gains that we have all realized over the last couple of years. Similarly, advancing localization. We want to strengthen the participation of national actors. We want to strengthen local and national governments to take on their key mandate to their citizens. And we want to promote equitable partnerships and resource flows across the board. We want to see sectors and clusters which inevitably transition and really are the face of the countries where they're positioned. Lastly, and importantly as well, which is one thing that we've done well over the years and we'd like to keep doing together, is really coming together around the working groups where we collaborate together, we develop guidance, we bring different perspectives into place. We had very good, practices that we shared last year, MPOX, certain epidemics, and we came together. And so just to remind all partners, the working groups are there. Let's keep coming together. We'd like to collaborate. We have all different areas of expertise, and we bring different networks on the table. So in a nutshell, those are the 7 pillars, and we will be sharing with you, if you haven't already received, the annual work plan. And we are really welcoming your inputs, your feedback, and importantly, we welcome your contribution to the realization of the work plan and the strategy. Next, Colleen. So as I wind up, just to, as a segue on the collaboration piece, is to highlight a little bit on what we achieved through the working groups. In 2025, we were able to come up with 26 publications through our collective, processes, and through the working groups. 12 webinars were achieved in 2025, and all these are available through the GNC website. We encourage you to keep logging into the website and connecting yourselves with, the events, the resources that we keep updating there. We have 13 working groups led by various partners. I hope you all see yourselves there: ACF, IMC, Save the Children, ENN, Concern, WFP, Nutrition for Development, SUN, the Red Cross, of course, and UNICEF. And in 2026, some of our key areas of focus across the 13 working groups that are listed will be to continue coming together to find areas where we do need to address technical gaps by developing interim consensus-based guidance, expanding our engagement of the working groups, particularly with countries, broadening our membership. We would like to see more national actors, reaching out and participating and benefiting from our global engagements, and also strengthening our GNC Collective community. We would like all of you to see yourselves in these working groups, to re-engage and to get more active, to keep these working groups functioning and even achieving greater results in 2026 and beyond. Thanks, and I think I hand it back to you, Colleen.
Thanks very much, Vic, for walking us through both the GNC work plan and also what our various working groups have been up to over the last year. And just to say that the work plan is available on our website, and there's a link in the chat for that. And if you are interested in participating in one of the GNC working groups and you're not already, if you go to the website, there is contact information for the chairs on each of the working group pages. So I encourage you to take a look there. So now we're going to shift gears a little bit, and we're going to hear some updates on the organizational changes that are taking place so I invite Gwen from the World Food Programme to kick us off first, to share updates from her side, and then I'm going to pass back to Anne, and she's going to take us through updates on her side from UNICEF. So Gwen, are you there?
Yes, thank you, Colleen.
Excellent.
Hope everyone can hear me. Good morning, good afternoon, good evening to all. Welcome to this call. So on WFP side, we have been through a lot of organizational restructure in a way. So now we have at global level, regional level, we are one global HQ. We have people that are outposted in the region, either technically or also on management. We still have some regional bureau, but they are not really connected. We are connected with them, but our technical colleagues are based in the region. So we are one team as global HQ. We have reduced the number of regional offices. We now have 5 regional offices. Johannesburg has been closed at the beginning of the year, and the other remains the same in Bangkok, in Cairo, in Nairobi, Dakar, and Panama. And then we still have our HQ based in Rome. We reduce so drastically the number of people either based in Rome or outposted in the region. We are a smaller team, and then the country remain the same. The work is really done from the global HQ with our colleague outposted, linked directly to our country office. So it's where we are. For nutrition now, in Rome, as Global HQ, we are not a nutrition division anymore, but we have been merged with school feeding and social protection. So we have one director overlooking at the three pillars, Ilaria Dettori, and then we have a program director above us and our assistant executive director. So it's where we are for WFP. And then what is happening in country office level is more based on the funding availability. And there is a lot of restructuration going on, depending how well our country offices are funded. And so we have in some country less technical capacity, and we are trying to support them as much as possible compared to country where we have a bit more capacity. So it's where we are for WFP, and I will hand it over to Anne for the UNICEF update. Thank you.
Thank you, Gwen. So for UNICEF, next slide, please. I don't have really anything to present on the slide, but just a verbal update, same as for Gwen. So there are some similarities with the WFP restructuring, but also some differences. So basically on UNICEF side, we've seen a merge of the regional office program teams and the global program group. So now we are in one global program division. So it's no longer program group, but program division. And for each sector, we have a so-called global practice. So we have now a global practice on child nutrition and development, for which the main location is Nairobi. So we have 5 hubs: Nairobi, Amman, Bangkok, Panama, and Brussels, where we have these global practices. But so for nutrition, the main one is Nairobi. We do have nutrition and emergency specialists in each of these hubs, except for Brussels, because that's mainly the Child Nutrition Fund. But we do have NIE specialists in Nairobi, Amman, Bangkok, and Panama. The people in these locations do not have a geographic scope, but are focused really on the area of expertise. So meaning that someone who is based in Panama, for example, might indeed, yes, be focusing on a lot of countries there, but might also be covering other countries globally. So we really don't have that regional focus as per the regional office geographic scope. And overall, we also have seen, of course, a reduction in the number of people. That has some implications. For example, we've been speaking and as part of the work plan about the global technical working groups. But at the regional level, we also had some working groups. We are now looking into how we organize that given the changes that we have seen in staffing. But for example, yesterday we started again with the first meeting of the year for the regional NIE subgroup for West and Central Africa. But so definitely there are some rearrangements to be made there. Also in terms of the supply pipeline updates, previously that would be managed through the regional offices. So basically the regional offices program teams or nutrition teams would be reaching out to the country office nutrition teams and then putting together those supply pipeline updates and then sharing it to the global level. While now we've put a new system in place where we work with our global supply division, and which is based really on the supply data that are in their system, which gives us more robust data. And Ben will be presenting the results of the first update and provide more details on that. So I think in terms of the restructuring, I'll stop here and I'll hand it over to Ben for the supply pipeline update.
Thanks very much, Anne, and good morning, good afternoon, and good evening, everybody. Yeah, as Anne said, I'm going to present the Q1 of 2026 Humanitarian Nutrition Commodity Funding Update. This is the first of some regular quarterly updates that UNICEF are going to be putting out. This one only includes ready-to-use therapeutic food, RUTF, but future ones will include other commodities, in particular the 2 therapeutic milks. So next slide, please. Before I show you the table, I just want a few words on the data itself. So the annual demand comes from the RUTF that UNICEF aims to procure and deliver in 2026, and this is mostly based on HACs, but in some cases the Humanitarian Action for Children Plan, and in some cases the Humanitarian Nutrition Response Plans. And in all cases, it includes needs for severe wasting, and in some countries that also includes a portion of the moderately wasted burden. And the assumptions include that the numbers of cartons needed per child are between 0.8 and 1, but we use an average of 0.9. And the total unfunded, so this is the total amount of the demand, as I mentioned above, for IETF that is yet to receive funding. And this includes both carton and freight costs. It does not include in-country logistics costs or programming. And finally, the estimated IETF, the estimated month that IETF is available until indicates the number of months that the current stock and funded pipeline will last, also considering other factors that might affect utilization of IETF. Next slide, please. So overall, we currently have for 2026 needs a gap of 3.1 million cartons at a cost of $173 million. And as you can see from the table, there are 6 countries that have their IETF pipeline secure for the remainder of the year. And the remaining of the countries would expect, based on current funding, expect a stock out before the end of the year. And the most critical or urgent of those being at the top, Afghanistan, Chad, and DRC. Importantly, we are as always, UNICEF have several conversations ongoing with various donors that will should lead to increased funding for many of these countries. That includes one firm commitment of 640,000 cartons for 16 of these countries. And there are many other conversations ongoing like this that will hope that will be able to help us meet some of the IETF needs before the end of the year. And next slide, please. And last slide. So UNICEF's doing taking various actions at global and country level. So we're continuing, or as always, to monitor the nutrition commodities in key contexts. So mostly the 22 countries that you saw before. And there are some other countries sort of on the fringes like Angola and Pakistan that we're also keeping a close eye on. And we're taking action to maintain a consistent supply and prevent stockouts. So at country level, very briefly, working with partners to track stocks and ensure timely replenishment, exploring where there are contingency stocks for UNICEF contingency stocks or partner managed ones. And at global level, matching the most urgent needs with funding opportunities and highlighting supply needs with donors, and ensuring strategic procurement and shipping and freight to ensure that any effects of disruptions to supply chains are anticipated and acted upon early. And also prioritization and programmatic adaptations, so prioritizing target areas for the most vulnerable populations and introducing programmatic adaptations like reduced dosage of IETF in line with national guidelines and WHO recommendations whenever necessary. And finally, strengthening the supply monitoring and communication. So we're constantly developing the process that Anne mentioned, and of which this is an outcome, to make sure that we have providing more accurate, understandable, and comparable data. And we will be putting out a quarterly publication, like I said, on a regular basis. So you can expect that, and as I said, including therapeutic milks for the next one. And also, at a country level, we're across key contexts rolling out the last mile supply monitoring solution that will give us much better visibility of IETF supplies all the way down to the health facility level. And finally, we welcome, as always, any questions or feedback on what I've presented, in particular how we can strengthen this information to make it as useful as possible for as many of you as possible. However, if it relates to a specific country query, I will do what I can to answer, but most likely be more effective if you go directly to the UNICEF country office for any specific queries. Thank you very much, and over to Gwen, I believe. We're sandwiched between Gwen.
Thank you, Ben. We can move to the next slide. So for WFP, what is the pipeline covers 6 months outlook from April to September based on the implementation plan of the country office and the SNF already purchased. It covers prevention and management of wasting and undernutrition, children under 5 and pregnant breastfeeding women. SNF only, it's not including the cash-based intervention that we have in many countries. What is not including either is the pre-positioned stock available in strategic location that could be tapped into, is not reflecting the additional funding that is coming from the US in-kind donation for DRC, Ethiopia, Kenya, Haiti, that will most probably come toward the end of Q3, Q4. The overall picture is that we have 50,000 metric ton SNF that are secured for prevention and management. We have a pipeline gap of 40% through September, but we have possible mitigation measure if we have more funding coming. Can you move to the next slide, please? So as you will see, it's a detail per country, and you can also move to the next one. What is happening within WFP is that prevention is being deprioritized. Management is first. Like Central African Republic, Niger, they don't have prevention. You can move to the next slide. The Sudan, they only had prevention from January to March, but nothing toward the end of the year. Somalia is only covered for wasting management for children under 5, nothing for malnutrition, nothing for prevention for children under 2 in the current circumstances. So these trends risk higher future caseload and cost, especially for children and women. So overall, the nutrition pipeline for WFP is under strain, with prevention, especially maternal nutrition, most affected. Again, if you want more detail per country, if you have any specific question, please come to me, and I will be happy to respond to any question you may have. Thank you, and over to Colleen and I guess Rasha. Thank you.
Yeah, thanks very much, Ben and Gwen, for those updates. I'm now going to invite Rasha to share an update on GNC field support that that's ongoing. So over to you, Rasha.
Thank you, Colleen. Guys, as you know, GNC field support is a service provided by the GNC Rapid Response Team and GNC NIE programmatic advisors. So in the previous period, we managed to reach out to those countries with specific dedicated support. Mali for cash voucher assistance, Sudan for the capacity strengthening for local national actors, and also supporting advocacy efforts through the development and finalization of the call to action for the 3 districts in North Darfur in particular, in addition to having the global partners call for advocacy. Also for Syria, emergency response preparedness, contingency planning, and NIE support. For Afghanistan, localization, and also emergency preparedness support. For Yemen, subnational planning. For the multi-sectoral action planning, in person also support by myself the last 2 weeks. For LAC, support for wasting, and also for Palestine, the capacity strengthening for local national actors. For Cameroon, Nigeria, and Chad, support for the transition process, Cameroon and Nigeria among the countries for accelerated transition to sectoral coordination, while Chad is under potential transition. So for those 3 countries, we are supporting them in the transition process, identify areas and gaps for support. South Sudan, anticipatory action support. Somalia, also localization support. DRC, localization. Madagascar, for nutrition resources. And from Bangladesh, IYCFE support, especially for targeting local national actors. and Jamaica NIE programming and coordination support during the emergency, and also Myanmar, the ABC related models, how we can support them to review the models, the successive models, and ensure that the linkages with the cluster coordination system exists. So for other also areas, climate crisis and nutrition e-learning course development have been completed, and also the cash voucher assistant e-learning courses have been already online, and finalizing the capacity strengthening need assessment protocol, and starting the implementation also of innovative also project for AI and how to link it with capacity strengthening to enhance localization, how local NGOs can access different resources of the GNC with multiple languages. So we are working on that. So this is in a nutshell is the country provided or the support provided to countries in the previous period, but also there are many things that have been provided to all the countries in need through the help desk. So please always return back to the GNC newsletter. There is a support button there. Write to us. All the countries, all partners are feel free to reach out to us in case you need any references, any guidance, and like to answer any of your questions. Over to you, Colleen.
Great, thanks so much, Rasha. So I'm now going to invite Robin. Robin is our advocacy consultant at the GNC, and she's going to share an update on what she's been working on and the vision and way forward for our advocacy work. So Robin, over to you, please.
Wonderful. Thanks, Colleen. Really lovely to be here. So briefly, as we look at where we're heading in the advocacy space, as explaining and describing the different domains of work that the GNC is looking at over this next year, the vision for advocacy moving forward really links back to domains 4 and 5. One around looking for more ways to center LNA voices in advocacy and ensuring and creating greater proximity between those that are the closest to the ground with the donors that we're working with to help shape policy related to humanitarian nutrition action as well as financing. And then domain 5 around trying to feed and fuel the engine for humanitarian nutrition action, both in terms of programming and the architecture around programming. So our proposed areas of focus really tie in to a lot of what you've heard this morning around significant gaps on the one hand for humanitarian nutrition response. And so being able to profile the needs and the current context in which humanitarian nutrition action is required. So that's sort of that second piece around increasing awareness and financing. And you may have seen us do that recently around Sudan. And there are other contexts that we're looking to try and profile and highlight and put in front of donors as they're continuing to look at allocations. And then the other area is around shaping policy and increasing financing for what we're calling humanitarian architecture. And I love the language that Inez had used earlier around what are the permanent resources that are required to make humanitarian nutrition action possible. These pieces around coordination, information management, peer learning. How can we continue to see those elevated, and particularly in this time of transition and area-based coordination, to feed and inform best practice in that space to allow for seamlessness and for continued investment in those really core enabling functions. Next slide, please. So there's 3 initiatives that are in front of the GNC leadership right now to be thinking about as way forward. One, as Ben was talking about, just the value of being able to put forward regular reports that give donors and advocates insight into gaps and needs to help inform decision-making. We're looking to do similarly with some of the information that the GNC has the privilege of being able to collect on a regular basis, whether it's looking at country-level gaps against the HNRP or other situational updates to be able to provide that in a timely and regular rhythm to be able to both enable the advocacy of others and also be able to shape donor decision-making. A second is to reactivate the Advocacy and Communications Working Group. Now, there we're really looking to bring together both technical and advocacy specialists with a mandate and an interest and experience in humanitarian architecture to be able to surface recommendations and solutions. We've already heard some of those recommendations earlier in this call, to help inform the way that these continued transitions take place, and so that we're helping to continue seeing that funding flow for those critical functions. And then third, looking to facilitate an increasing number of dialogues between donors and decision makers and those LNA actors, so that we're realizing our ambition around localization in every aspect of the GNC's work, including donor influence and donor engagement. So I mentioned Sudan. Our engagement around Sudan is sort of one small example of the way that we're thinking of working now moving forward. As some of you may have been able to join our Sudan partner call earlier this year, which then produced a Sudan donor briefing note and a whole series of outreach opportunities with donors in the lead up to the Berlin Conference on Sudan. And now we're anticipating another round of briefings and engagement with key philanthropies related to Sudan. So this is the kind of work that we're hoping to do for multiple countries moving forward, to really be able to speak to needs and help donors with really smart decision making. Colleen, back over to you.
Great. Thanks so much, Robin. So that takes us through the part of our agenda where we were providing updates to you on a slew of topics. We hope that it was helpful. So now we have to the bottom of the hour together, and this is a time for us we can answer questions that came in the chat box, or if you haven't put them there already, feel free to do so. And also, it's a space that you as partners on this call, if you have an update that you would like to share with the collective, we certainly have space and time for that now. So if you would like to raise your hand to indicate that, you can, or you can put in the chat that you would like to do an update, and we can unmute your mic to do that. So maybe while you're thinking about that, I'm going to, we do have some questions in the chat. So I'm just going to take us back to them. Now, this first one is about the humanitarian funding to local and national actors. So Alexa, her question was, although some countries have achieved 25% of country pool-based funds being awarded to local and national actors, these funds are only representing about 6 to 7% of all humanitarian funding. OCHA reported data on direct funding to LNA actors shows that it's often less than 2% of overall humanitarian funding. And then she provides an example from South Sudan, where last year it was 0.4%. Do we have a plan for tracking this and setting goals to increase the percentage of direct funding of local and national actors in countries that have an active coordination group for nutrition? Maybe Stefano, this would be a question for you, as you flagged the LNA funding in your reset update. So can I invite you to comment on that, Stefano?
Yes. Now I cannot comment on the specifics. I don't have the full information with me, but I believe that for the UNICEF-led clusters, the figure already is more than 40%. And I think it sometimes it varies what the denominator is. In many countries, a large proportion of funds as well is dispersed directly to national authorities, like the Ministry of Health, for utilization in the health system or others. And and a lot of other funding of national actors sometimes is under an umbrella led by either a UN agency or an NGO to ensure that even small NGOs are able to fulfill the sometimes very difficult the demands of donors in terms of financial and monitoring reporting. So it's very difficult to really have a specific figures, but I'll refer to them or on the information that they got from OCHA to really have greater specificity about what it is reporting. But I cannot add from the top of my head more specific figures. Over.
Thanks, Stefano. So our next question, Tariq asks, we heard from Inez talking about when there's a plan to deactivate the cluster and supporting that transition. So on the topic of transition, Tariq asks, are there plans to strengthen the capacity and structure of the global RRTs to support this process at the country level, the process of being able to make the transition? So Rasha, I'm wondering if you can speak to how the GNC team is supporting transition.
Thank you, Colleen, and thank you, Tariq, for the question. Yes, from our end, we have this accountability to support countries during the transition process, starting from the development of the transition plan, and also working closely with the cluster coordination team to identify the gaps that needs to be addressed in terms of the capacity development, in terms of the preparedness, and other aspects, and also the other NIA thematic areas. And based on that, based on the discussion, based on the need assessment and the gap identified through the discussion with them, we put together a plan after finalizing the transition, developing and finalizing transition plan. Also, what we can do, we just conclude, for example, a blended training for Nigeria was part also of the transition support package, for example. We just concluded this week, and we are going to do the same for other countries in the transition. So yeah, our rapid response team working closely with the coordination team in the countries, identify the gap and how we can address them, not only regarding the transition plan, but also regarding capacity strengthening, localization, and other areas. Thank you.
Thanks, Rasha. I've just been scrolling through the questions here, and thank you to our presenters. You've been answering a lot of them as we're going here, so I'm not gonna voice those ones out. Let's see. Okay, I think we've addressed the ones that are here. So I invite just a space now and a time now if any partners on the call would like to update on any initiatives, or if you have a question that you haven't asked yet, and now is a chance to do that. So I'm going to give us a space to do that. So you're welcome to either raise your hand or put your question in the chat. Or feel free to give an update. All right, I'm not seeing anybody jump up at this time, which is absolutely fine. So I think we're going to wrap up a few minutes early and give you an extra bit of time back in your day. I just want to thank you on behalf of the GNC team for joining this call today. We hope that this was a helpful update for you. We will be sharing the recording and the slides on the GNC website, and we'll let you know when they are up. And we do very much welcome your feedback on these calls. Are there things that you expected to hear today that you did not hear about? Please reach out to us, anyone on the GNC team. It will be happy to take your feedback, and we will look to inform the agenda next time around. So Again, thank you, everyone, and I wish you all the best in the rest of your day, and bye for now.
Bye.
Bye, thank you.